The topic of my talk today is identifying and eliminating visceral fat for optimal health. So what's the purpose of human optimization or lifestyle medicine as I see it? Well, it's to help my patients live the longest, most active and fulfilled lives possible. And it's to help them to do that by identifying the most significant and modifiable biomarkers for improving health. What this means is there needs to be something that we can tell you that you can improve on, that we can measure easily and give you actionable advice to address. And I think, and this is obvious, that lifestyle is always going to be the way that we address this most optimally for a disease caused by a lifestyle. So again, let's think about that ladder. You're either dying, you're surviving, or you're thriving. And I really think that most people, if they're eating a standard Australian diet and they're exposed to a standard Australian light environment, they will definitely just be surviving. But what we want to do is identify the biomarker that is keeping you there and preventing you from getting to the next level. So what we were used to, well, this is the peak performance. This is what we evolved doing. And there was no hospital. There was no, this guy didn't go see a GP at all, but he was in prime health. And again, that's where we're at collectively. So the question is, what is appropriate based on our biology, and what factors can we address, particularly to identify why we're here instead of there? I want to talk, and this topic will be about visceral fat. So what is it, why it's so harmful, why you might consider getting an MRI scan, and what factors will be causing the deposition of visceral fat, and perhaps how can we get rid of it. So I want to start by explaining that not all fat is the same. There's subcutaneous fat, which lives underneath your skin, and it secretes a whole bunch of very important hormones, and it's a very hormonally active tissue. But its role in the body is energy storage in a physiological way. So it is very, very useful, and it's metabolically benign. We also have some brown fat, and again, this regresses as people get older and babies have a lot of it. But the role of that is to generate heat. And a third type of fat, which visceral fat is a prime example, is a pathological type of fat. And this lives deep inside the abdomen. So you can see the subcutaneous fat is going to be under the skin. Visceral fat is inside the abdomen. And all these different types of fats have extremely different effects, both on inflammation and metabolism and how the body is operating. So visceral fat is a form of what's known as ectopic fat. So what is ectopic fat? It's fat that is occurring in an abnormal position or in an abnormal manner or form. As I said, it's a problem, and it's secreting what are known as very pro-inflammatory cytokines, which are molecules that inflame the immune system and cause inflammation in the body. It also secretes substances that increase the likelihood of blood clotting. The presence of ectopic fat represents a fundamental dysfunction in your body's ability to deal with energy and metabolism. I liken it to a dumpster fire. Visceral fat is the dumpster fire inside your body, or the radioactive spill. Either or, you can take your pick. The visceral fat is not the only type of ectopic fat. So it is the one that I'm going to be talking mostly about, because it actually is a proxy for other sites of ectopic fat. So we've got fat inside the liver, which is known as hepatic steatosis. We've got fat around the heart, pericardial fat. We've got fat inside the muscle, known as myosteatosis. And there's even ectopic fats in the upper airway and the tongue. So what does this look like? Well, the best way to understand and visualize different types of fat is through an MRI scan or a CT, but MRI doesn't involve radiating you. So what we can do is we can basically take a slice of your body at different levels and look at what's going on under the hood. So you can see in this patient, this is an incredibly healthy person. So in the white is fat, it's subcutaneous, and everywhere else there's very little fat inside the abdomen. Visceral fat, 0.5 liter. This is someone who has subcutaneous fat, but look at all this white stuff. That white stuff is visceral fat. That's the chemical spill. That's the dumpster fire going on inside this person's body. What if we look at different levels? Well, if we take that level up to the level of the heart, well, we can see something similar. You've got accumulation of fat around that heart. That's pericardial fat. And if we take a little bit lower, this is at the level of the upper lower leg. This is a bone. These are your tibia and your fibula. This is in a young, healthy athlete. There is no intramuscular fat in him. He is incredibly fit and healthy. This is a 65-year-old diabetic. You can notice how there's intramuscular fat, ectopic fat within that muscle, and that's a problem. Why do we care about visceral fat and other forms of ectopic fat? Isn't it just a bit of human marbling or human foie gras? What's wrong with that? These taste great. Well, I'm about to tell you. Even though it tastes good in animals, this is a massive problem if it's in humans. The reason is because visceral fat, hepatic fat, and other forms of ectopic fat go hand in hand with what's known as metabolic syndrome and insulin resistance. What is metabolic syndrome? Well, metabolic syndrome is the overlying path to chronic disease. If you have metabolic syndrome and the consequences of metabolic syndrome, you are going to become ill. You are going to become debilitated before your time, and you're going to be living very much at the bottom of that ladder that I mentioned. So what I want you to appreciate is that there's massive individual in the variation in the location and the propensity to deposit visceral fat, depending on who you are, depending on your genetics, and depending on your environment. But what I'm going to talk to you about is how you can modify it with your lifestyle. So metabolic syndrome, there's basically 5 criteria, and what they found is that people that had these 5 criteria were at high, or more than 3, were at more high risk of developing cardiovascular disease and a range of other chronic health conditions. The moment you've got more than 3 out of 5, and I would argue, eat any of them individually, you're beginning your path to chronic disease. So how does this relate to visceral fat? Well, the findings from epidemiological studies over the past 30 years have shown that visceral adipose tissue, accurately measured by CT or MRI, is an independent risk marker for cardiovascular and metabolic morbidity and mortality. And they further states that ectopic fat deposition, including the hepatic and epicardial fat, might contribute to increased atherosclerosis and cardiometabolic risk. So this is a later in the review paper, and this is the list of conditions that is associated with visceral fat. So when you think of visceral fat and you think of the dumpster fire inside the abdomen, this is potentially the list of conditions that you could develop over time. As I mentioned, insulin resistance is the overlying disease process at play, and we go down hypertension, heart failure, coronary artery disease, respiratory disease, sleep apnea. And what do we talk about? The fatty tongue. The reason why sleep apnea occurs with ectopic fat deposition is because the tongue gets too fat, and that obstructs the upper airway. Not only cardiovascular, but also dementia, reduced cognitive function. All these are sequelae of excess ectopic fat and insulin resistance. Cancer is a big one. Almost every cancer there's lots of evidence showing that the outcome of cancer patients who have more visceral fat is poorer compared to those who have less fat. And for the ladies in the audience, PCOS or polycystic ovary syndrome is insulin resistance and is associated with visceral fat. And that's another example of what we're dealing with here. This is all a process that is occurring with excess visceral fat. So what about BMI? And the reason I want to talk about BMI is because that is what most people talk about. We're either overweight, we're underweight, we're obese, as per a BMI, a body mass index, which is your weight over your height squared. And we've got a range of targets. The problem with BMI is that it doesn't offer any insight into the type of fat that you've actually got. So do we know how much visceral fat or subcutaneous fat? No, we have no idea. It doesn't give us that idea, any insight. And what matters is that visceral fat, and it also matters the duration of that visceral fat. And the longer someone has an abdomen full of visceral fat, the more likely they are to develop the metabolic side effects that I mentioned previously. So what I want you to show here is another MRI scan, and again, this is all of different individuals. What you can see, again, in the outside is their subcutaneous fat, and inside a visceral fat. This is our healthy athlete, and down the bottom is our most unhealthy person. Look at the difference in the amount of visceral fat in all their abdomen, and the degree of that white inside that abdominal cavity is the amount of visceral fat. And you can see that person has got 3.6 liters compared to this gentleman or person that only has 6.63. So the surprising thing that I want you to think about is these people all have the same BMI. That's a normal BMI. That's not overweight. So if you went in and got seen by your doctor or someone else who measured your BMI, they calculated it, they'd say, oh yeah, that's okay. You're not even overweight. You don't even have a BMI that's overweight. But if you're this person, you're in the danger zone. So what this means is that we can't rely on a normal BMI to reassure us that we don't have visceral fat. Let's look at some more examples of this. So this is someone, and they've highlighted here, in green is subcutaneous fat, and the blue is visceral fat, and red is muscles. So what we can see in this patient is that they've got low amount of visceral fat and they've got minimal subcutaneous fat. This is a metabolically healthy person, and they would also have a normal BMI, but they are healthy. Let's look at this person. They've got a massive amount here of subcutaneous fat, but they've also got very little visceral fat. So this, paradoxically or surprisingly, is what we call a metabolically healthy obese. So this person is not at the same risk as someone who has the same BMI but is caked with visceral fat. And finally, this person, again, is probably similar to the one I mentioned at the end of my previous slide. They have not a lot of subcutaneous fat, but they've got a large amount of visceral fat, and they are very metabolically sick, and they're going to be high risk. So let's think about a table here. So you can be, what's your BMI? What's your subcutaneous fat? How much visceral fat do you have? And how likely are you to be insulin sensitive or insulin resistant? So with low amount of visceral fat, you're going to be very insulin sensitive, and you're going to have a low risk of long-term chronic disease. What's known as the TOFI, which is a thin on the outside, fat on the inside, they've got a normal BMI, but they've got a large amount of visceral fat. They're going to be insulin resistant, and they're going to be on their way to chronic disease. And we've also got people who've got a raised BMI, and they've both got a large amount of subcutaneous and visceral fat, so they are also going to be high risk. And finally, we've got those metabolically healthy obese. They are insulin sensitive despite their large BMI and despite a high amount of subcutaneous fat, but because they have a low amount of visceral fat. The point that I really want you to emphasize is that we need to know if you're a TOFI, and that's key, because these people are being classified as low risk, or they're not being informed about the amount of risk that they currently have. So what about my LDL cholesterol? So and if you notice when I brought up the slide about the metabolic syndrome, LDL or total cholesterol was not on that list. We were talking about triglycerides and we were talking about HDL. So I thought this study from 2009 was very interesting. So what they did is they looked at over 50,000 patients who had been hospitalized with heart attacks, with a range of other diseases or presentations of coronary artery disease, and they took their blood lipids around 24 hours after admission. What they found is that almost half the patients hospitalized with coronary artery disease have an admission LDL cholesterol that is essentially normal. And they conclude a substantial proportion of patients present with their first or recurrent heart disease event well within the current guideline recommended targets for LDL. So we're thinking about a biomarker for health optimization, and we're thinking about how we can help you do the best thing by your health. Well, this doesn't look very good if half the people who came in with a heart attack had a normal LDL cholesterol. So the elephant in the room really is visceral fat, and that is the thing that is not being talked about, and that is the factor that the risk factor that is really important that isn't being mentioned. And what we can, those that are insisting or myopically looking at LDL cholesterol without taking into consideration visceral fat, insulin resistance, metabolic syndrome, I think are like the blind man feeling the elephant. So really, the root of the problem is visceral fat. And identifying visceral fat is the 80-20 of health optimization. Let's think about what's driving this problem. There's 4 key areas that I see that drive the accumulation of visceral fat. Circadian disruption, processed foods and carbohydrates, alcohol and other toxins, and chronic stress. So circadian disruption, the presence of artificial light at night is critical in disrupting our body's ability to regulate its metabolism. That light signal, which reduces your body's ability to make melatonin, elevates its cortisol instead, and that is sending an incredibly confusing message to your body's energy storage systems. That artificial light at night will drive overeating. It will drive what's called hyperphagia, and it will force people to influence them to put more weight on than they would otherwise. The absence of sunlight exposure. We need sunlight during the day, during the morning, to allow our bodies to remain what's called leptin sensitive. And as I mentioned earlier, leptin is one of the hormones that gets secreted by our fat cells. It tells the body how much energy there is on board. When we get our circadian rhythm is disrupted, our body becomes resistant to the effect of leptin. It's unable to understand how much energy it's got on board. So it will drive overeating and it will drive weight gain. Shift work is particularly problematic, and it's very clear to anyone who's worked in a hospital or a shift work situation. When you see night shifts come on, and there's particularly the people that are doing prolonged night shift, they are almost invariably, on average, more overweight than the day shift staff. And circadian disruption is playing a critical role in this. And poor sleep. And poor sleep is reflecting the fact that the body is not performing its proper repair mechanisms, and that shows how important circadian disruption and sleep is to optimal health. So dietary drivers of visceral fat. The one factor that is possibly the most important of these, I believe, is polyunsaturated seed oils. And they're different. They're not the same as the polyunsaturated fatty acids that we were talking about in the previous presentation. These are plant-derived omega-6 fatty acids, and they're particularly enriched in what's called linoleic acid. And linoleic acid is problematic for a number of reasons, but it breaks down into a whole bunch of highly toxic chemical byproducts. Several of these are also going to be driving overeating. They're going to be driving consumption of hyperpalatable food, because they act in the same way that your brain's endorphin systems. So when you eat foods that contain seed oils, your appetite and your satiety is being hijacked, and they're going to very, very much drive the accumulation of visceral fat. Carbohydrates and refined grains, sugar, ultra-processed foods, and any type of liquid calories that contain sugar are going to be rocket fuel for depositing visceral fat. And fruit consumed out of season, it's not a health food when it's consumed out of season, and that's because it's incongruent with the messaging that you're giving it through your solar exposure. During the winter, eating bananas is not a good idea. So chronic stress is, we were designed to have an intermittent amount of stress that was then resolving, temporary and then rest. But unrelenting and chronic stress, which we see today in so many of our modern environments, is going to very, very potently deposit visceral fat. And those effects are mostly mediated through cortisol. Alcohol. So alcohol, again, is possibly one of the easiest things to cut out if we want to address accumulation of visceral fat. It goes hand in hand, and what we know is that when cutting out alcohol, fatty liver particularly can resolve very, very quickly. There's other good evidence that endocrine disrupting chemicals, including BPA and other endocrine disruptors like phthalates, which exist in plastic water bottles, which exist in the environment, they are, when consumed, can drive obesity and visceral fat. And there's also evidence, particularly in animal models, that low dose or contamination of food with herbicide like Roundup drives fatty liver disease. So additionally, there's certain medications like long-term insulin and steroids that will also cause the accumulation of visceral fat. So the point that I want to make is that these factors are all interlinked and they're overlapping, and it's never going to be one factor. And they're all people who are, as I mentioned, are going to have a disrupted circadian rhythm are also the same people who are eating the bag of chips, 2 a.m. on the night shift, and drinking from plastic bottle, doing things like this. So there's not only one factor, and they all amplify each other. Again, let's adopt an ancestral lens. And what point that I want you to take away, and perhaps maybe the most important point of my talk, is that visceral fat will accumulate in proportion to the degree that your lifestyle is incompatible with your biology. So how do we solve our visceral fat? How do we readjust our lifestyle to minimize the likelihood we're depositing this very dangerous type of fat? Well, we need an optimal light environment. We need to see the morning sunlight, because that is going to be critical in programming our circadian rhythm, in making sure we're leptin sensitive, so our body knows how much energy is on board, and we can get to work removing that visceral fat when that circadian rhythm is regulated. Exposing our skin to the sun throughout the day is incredibly important. It doesn't take long. Ideally, do what you can and get a little bit in. Blocking artificial light at night will also is a key part in preserving that circadian rhythm, because when you are exposed to artificial light, your body isn't making melatonin, which is that key hormone of repair, and instead it's going to be making cortisol. And ensure consistent high quality sleep. Blue light blocking glasses or blue light blocking clip-ons is very important. So what's an optimal human diet? Well, I believe that adopting a very, very low carbohydrate or carnivore diet is the most effective way of reducing visceral fat. The reason for this is because it cultivates such a low insulin environment, and it is really addressing insulin resistance right at its root cause. The implications of adopting a carnivore or extremely low carb diet as well allows that gut to heal. And so much of the dysfunction and that we see from a processed food diet particularly is involved in gut permeability and the inability of your gut lining to make an effective barrier against the intestinal contents. So a carnivore or animal-based diet is really going to be effective there. Fermented vegetables and seasonable consumption of plant foods might be appropriate in some. Meal timing. And this is what I want people to think about is eating like a lion or a great white shark. So rather than a cow that's grazing all day. So lions will eat 1 or 2 big meals and then they will just be resting and digesting. So fewer meals less often is the strategy to taking back your metabolism and helping you heal and deal with your visceral fat. 1 or 2 meals a day is a great approach, and fasting. So those who aren't medicated with antihypertensive medications or heart failure medications or other types of medications, particularly, fasting is a great way to kickstart the process of visceral fat loss, and is very safe. It's free, so I would definitely consider that. And eating during daylight hours. Again, this is about sending our body the most appropriate circadian signals, and eating throughout the day when the sun is up is the most appropriate, and not when the sun's gone down and it's 10 p.m. Eliminate toxins, so greatly reduce alcohol, eliminate it or get rid of it, because that is, again, driving your visceral fat accumulation. Water filtration for endocrine disrupting chemicals, avoiding plastic contact with foods, and avoid some synthetic fragrances and care products, because they contain endocrine disrupting chemicals that you might be fighting against in your effort to lose this visceral fat. And minimize stress. We want, as we said, we want acute temporary stresses, not chronic stress. Nature and yoga are a great approach. And think about ancestrally. We would have had exposure to a tiger, we would have run away, and then we'd be resting. We wouldn't be having the tiger living next to us in our bedroom, but that's the lifestyle that most people are living today. And high intensity exercise. So possibly the most important physical activity you can do to get rid of visceral fat is maximum intensity. And certain physicians that have also noted that chronic cardio exercise can have the opposite effect in retaining visceral fat rather than eliminating it. So for that reason, I encourage maximum intensity within your capability. Sprinting is the best, and work out outside and not under artificial light. So the loss of visceral fat can be as quick or as slow as you want, based on stacking these type of lifestyle interventions. And the goal is eventually to live a lifestyle that minimizes visceral fat accumulation and prevents it from coming back. So in closing, think about MRI scanning for visceral fat. And once you realize that the risk exists in your visceral fat, then looking directly at the disease makes the most sense. MRI scanning is going to be superior to the other modalities like CT, again, because it gives you the highest resolution images, and it gives us, does it without any ionizing radiation. And it's extremely motivating for people in terms of lifestyle change to be able to see that dumpster fire going on inside their own abdomen. And if not, identify metabolic dysfunction. So identify the signs of metabolic dysfunction and metabolic syndrome, including that waist circumference, including that blood pressure, and particularly see a doctor who can understand metabolic health and do specific blood tests that can identify the earliest signs of metabolic disease. So in closing, the accumulation of visceral fat is proportional to your lifestyle incompatibility with your biology. Consider an MRI scan to visualize visceral fat, and eliminate visceral fat by adopting carnivore diet, circadian regulation, and ancestral lifestyle practices. Thank you very much.
Thanks, Max. That was great. Just a point on the waist circumference. Is it worth pointing out that the ratio between the height and the waist is what you're looking for? The ratio of the waist to the height is very sensitive.
it's less. It's obviously not as useful as doing an MRI scan, but in terms of what we can do in the clinic, the waist to height ratio is very, very good. And you simply just involves measuring that waist and the height and getting a ratio. Yeah, exactly. So what I like to see is below half in men and below about 0.48 in women. But
Hey, so with the BPA and plastic exposure and stuff, do you have any tips on how to avoid that with meat, for example? So, a lot of meat comes vacuum packed in plastic, and to avoid that is quite challenging, and keep it fresh at the same time.
Yes, so that's a very good question. How can we avoid plastic contact with meat? So the highest risk of leaching of endocrine disruptors is through liquids. So meat is not as bad as, say, oil sitting in a plastic bottle, but it's still something that we're working on. I mean, I've talked to Jake Wolke about this, and it's an ongoing problem because we need obviously to preserve the meat, and at the moment we don't have anything better than plastic. So we need some smart people to work on this problem and hopefully get a solution.
Yeah. And just to add, I heard that fat was the plastic was fat soluble. So if it's a fatty cut of meat, for example, it can actually dissolve the plastic and absorb into the fat.
Well, less likely. So yes, these compounds are overwhelmingly fat lipophilic, but usually in the case of being at room temperature or being at higher temperatures. So that's why the canola oil sitting on the shelf in the supermarket is so harmful, because that process of leaching is going to be occurring higher at higher temperatures. So, I mean, for refrigerated or frozen meat, we can only do our best, and I think that's okay.
Right. And you said the liquids was the worst, so bottled water was...
Yeah, it's not ideal.
Okay.
Yeah, by any means. Yeah, so great question. So how can we access visceral fat MRI in Australia? So that it's not something that's being offered at the moment, and it's quite challenging to get this because it's obviously not a Medicare refunded test. But there's a physician in the US, Dr. Sean O'Mara, who's doing this with his patients, and it's going to involve people like you demanding something like this and demanding to have access to a test that can help you identify your risk of developing chronic disease in this way. So it's something that I'm working on in Albury, and we hope to be able to offer it quite soon. And again, it would be an out-of-pocket test, but what we'd do, we'd get we'd get levels at the different levels, and then be able to show you those images and use those to guide weight loss. So yeah, to be announced. Thanks, Rob.
I was just wondering if you could you please put back up the slide on the LDL percentages or the measurement of that? Sure. Thank you.
It's not going to help you. Moving in the way.
So the point about LDL, and I want to emphasize that the context matters. So if we have a high LDL in the context of high triglycerides and low HDL, that's a problem. And it's going to reflect the fact that LDL is going to be oxidized. And the oxidation of the LDL is problematic in terms of developing atherosclerotic cardiovascular disease. The problem, though, is that it's nowhere near as reliable as a biomarker of predicting who's going to get a heart attack compared to, say, insulin resistance and visceral fat visualization.
In the absence of the fat MRI, or until that comes out, how useful is a DEXA scan?
So it will give you the proportions of subcutaneous versus visceral fat. It won't be as accurate in estimating them, but it's going to be better than using those tape measurements. The value of the MRI is really as behavioural change. So it's really visualising that dumpster fire, and it's just not the same when we just see a number on the DEXA report. So to answer the question, yes, it's definitely better than nothing, but not as good.
Thank you.
Hi, Elsa.
Max, are you able to talk on salmon and farm salmon? Because everything that I've looked at says that the omega-6 is massively high relative to omega-3. What I understand is we need 3 times the omega-3 to 6, and 3 times the omega-6 to 9.
Yeah, so I liken farm salmon to CAFO confined fed pork. So it's suboptimal for a whole bunch of reasons. It has a massive amount of inputs needed, as you know, subtherapeutic or therapeutic antibiotics and other kinds of miticides that permit it to exist in that farmed environment. So I think it's going to be suboptimal compared to wild caught, definitely, and I'm not surprised to hear that the fatty acid ratios are less favourable.
Can we fix it with us eating hemp, or is it wrecked already in the tissue of the patient?
Eating hemp.
Like eating high hemp, say high omega-3?
No, I would suggest, I'd probably suggest trying to source a better source of fish where possible, but you're probably still better eating farm salmon than occasionally than not eating it at all. Yeah. Definitely. So fasting insulin, again, is going to be much more sensitive than even those metabolic syndrome criteria for developing for emerging insulin resistance. So fasting insulin, I like to see it under 5 as a reference range. But in many ways, it's a proxy for visceral fat, and it's a proxy for ectopic fat in the way that it usually correlates quite well.
So I was just going to make a comment on the last gentleman who said, mentioned should we use hemp? I'm assuming you mean hemp oil, like omega-3 sort of rich plants and things like that. So the problem with those sorts of omega-3s is they're ALA as opposed to DHA and EPA. We don't need ALA. We can't really use it. So that's not really a helpful kind of omega-3. So it gets put under the blanket and the auspice of omega-3s, and omega-3s are good, but it's not. So you can convert a very small fractional amount of ALA into DHA or EPA, but it's minuscule. So it's really not helpful. You need DHA, EPA, and those only come from animal sources.
Yeah, thanks, Anthony. So marine sources of omega-3s.
Okay, all right. Thank you so much, Max. Guys, we're going to take a break for lunch now. Give him a round of applause.